Welcome back. We hope you enjoyed that dramatization. And now for the facts about vocal fold paralysis. Vocal fold paralysis is the complete denervation or disruption of the nerve supply to the vocal fold. The loss of nerve supply to the vocal fold causes the vocal fold to be completely immobile. There are two types of vocal fold paralysis, unilateral and bilateral.
Some of the causes include inadvertent injury during surgery, complication from endotracheal intubation, blunt neck or chest trauma, tumors of the skull base, neck, and chest that can squeeze nerves, or viral infections. Now please take a minute to pause this video and discuss these causes among your class.
Welcome back. We hope you enjoyed your discussion. And now for the symptoms of vocal fold paralysis. In unilateral vocal fold paralysis, one of the vocal folds is paralyzed. This is the most common type of vocal fold paralysis, and usually the left vocal fold is paralyzed. In this type, the folds are unable to close, causing voice and swallowing problems. The symptoms are a hoarse and breathy voice, you become winded from speaking, and you have a sore neck when other muscles try to help out your vocal folds when you're speaking. Also, your voice changes when accompanied by coughing and swallowing at the same time. In bilateral vocal fold paralysis, which is a less common type, both the vocal folds are paralyzed. In this type, the folds are unable to open. This causes a narrowing and a blockage of the airway. The symptoms of this type are noisy breathlessness during activity. Sometimes this type is thought to be asthma by doctors, which is very bad because bilateral vocal fold paralysis can be very deadly if the airway is blocked too severely. Now please pause this video and discuss the symptoms of vocal fold paralysis with your class.
Welcome back. I hope you had a lively discussion about the symptoms of vocal fold paralysis. Now on to the different treatments. First, there is vocal therapy, which is a glottal attack of the different vowel sounds. This is used within the first 12 months after being diagnosed, before surgery is even considered. If this has no effect, then there are 3 different surgery options. The first surgery option is medialization thyroplasty, where a block pushes the paralyzed vocal cord to the center. There is also the arytenoid adduction, which is the same as the medialization thyroplasty, except that it's stitched into place once the vocal fold is into the center. The third option is a vocal fold injection, where injected material, either fat from your own body or synthetic material, is pushed into the vocal fold so that it plumps up and it is also in the center to meet the other vocal fold. Now please pause this video and discuss the treatment options for vocal fold paralysis.
Welcome back. We hope you had another great discussion. And now for the long-term effects and damage of vocal fold paralysis. In unilateral vocal fold paralysis, if not treated, what once was a nerve problem can become a muscle problem, from the absence of using the muscles involved near the vocal folds. Once it becomes a muscle problem, it is much, much harder to correct. In bilateral vocal fold paralysis, if it is not corrected, then you could have a severe blockage of your airway, which could cause death.
Prevention for vocal fold paralysis is very hard, but certain things can be done to avoid this deadly problem. First, try to avoid any unnecessary surgeries, for even any type of surgery can cause vocal fold paralysis because of the tube they stick down your throat to breathe when under general anesthesia. Next, make sure you have a good doctor. A bad doctor operating on any part of your body can be very dangerous.
Please now pause the video once again to speak about the long-term effects, damage, and prevention of vocal fold paralysis. Welcome back. We hope you had yet another great discussion. Now we will look at some pictures of the anatomy of vocal fold paralysis. Take a gander. Healthy vocal folds. Unilateral vocal fold paralysis. The left vocal fold is paralyzed. Bilateral vocal fold paralysis. Both vocal folds are paralyzed. Notice the blockage of the airway.
Welcome back.
We hope you've enjoyed this informative explanation of vocal fold paralysis. We have explained the causes, symptoms, treatments, as well as the long-term effects, damage, and prevention of this severe vocal problem.
Thank you for watching our video.
Until next time, don't let your folds get the best of you.